My name is Ping Ye. I'm CEO of Vocxi Health. Vocxi has developed a disease agnostic and actually threat agnostic detection platform. I've got it in my hand, and essentially over the last near decade, a stealth team inside of Boston Scientific and the University of Minnesota have developed a new class of sensors that in this device takes a metabolomic snapshot of the body. Basically, we can take those patterns and relate that to a wide variety of diseases, from cancers to and even infectious diseases and foreign threats like poisons. My background is a nanotechnologist. Actually, I spent about 15 years of my initial career in tech. And then about 12 years ago, I was diagnosed with Hodgkin's lymphoma. And after that experience, decided to use my experiences and skills in the world of health. And so this is about my fourth company that I've helped get off the ground in the health tech industry. So what's unique about this technology is how rapid it works. So there is no processing of the breath elsewhere. It actually all happens in this device. So within seconds, the breath print pattern essentially gets analyzed in the cloud, and the results are essentially immediate. And as you can all see, the form factor is incredible. It can be handheld, and it's also mobile. So from the standpoint of accessibility and speed, it really stands out. One other thing that has caught the attention of a lot of governments actually, and government agencies, is the fact that this is shelf stable. There are no reagents that will expire. So this can sit on the shelf and be ready or prepare the country for the next unknown threat. So this has already been a phenomenal week. It kicked off on Sunday with the Johnson & Johnson BARDA Blue Knight program. And this week we get to spend time here at the Bullpen meeting like-minded, passionate entrepreneurs and also investors and partners. As you can imagine, this is something that will need funding. We raised a good $6 million round last year, and we're looking to do the next round to get us through clinical trials.